What do medical billing codes have to do with claim denials? Imagine trying to get your insurance to pay for a doctor visit and suddenly hearing that your claim was denied. What could cause that? Often, it comes down to the medical billing codes used on your claim. These codes are like a universal language that tells the insurance company exactly what services or procedures were performed. They include codes for diagnoses, treatments, and tests. If the codes are wrong or don't match the service, the insurance company might reject the claim. Medical billing codes are made up of letters and numbers. For example, a common code for a routine checkup might be one specific code, while a different code is used for a flu test. When a healthcare provider submits a claim, they include these codes to explain what was done. If the codes are incorrect, incomplete, or don't fit the patient's situation, the insurer might deny the claim. This is especially important for seniors, who often have Medicare or other insurance plans with strict rules. One reason claims get denied is incorrect or inconsistent codes. For example, if a provider uses a pediatric code for an older adult, the claim can be rejected. Or if they bill for a vaccine that isn't approved for seniors, that can cause issues. Modifiers are additional codes that give more detail about the service. Missing or wrong modifiers can also lead to denials. For instance, if a service was only partially covered and the modifier isn't included, the claim might be rejected. Another common cause is medical necessity. Insurance companies want proof that the service was needed. If the codes used don't match the medical records or the insurer's policies, they may deny the claim. For example, billing for a test too frequently or without proper documentation can trigger a denial. Duplicate claims are another issue. If the same service is billed twice, or if a claim is submitted after the deadline, the insurer will reject it. Coverage issues also play a role. If a patient has multiple insurance plans or coverage has expired, the codes might not match the payer's expectations. Certain code combinations are not allowed under the rules of the National Correct Coding Initiative. These coding edits prevent improper payments. If the codes used violate these rules, the claim will be denied until corrected. For seniors, accurate coding is especially important because their coverage can be complex. Errors can lead to delays in payment, unexpected bills, or even collections. Healthcare providers and billing staff need to carefully choose the right codes that reflected the services, the patient's age, and coverage details. This helps reduce denials and speeds up reimbursement. In the end, medical billing codes are the language insurers use to decide whether to pay a claim. Using the correct, complete, and compliant codes helps ensure claims are processed smoothly. When codes are accurate, seniors are less likely to face billing surprises or delays in their care. Proper coding is a key step in making healthcare costs manageable and ensuring assistance programs work as they should.